especially on matters to do with procurement and logistics. And it's good that you have also interned at KEMSA. I hope that was not during the COVID KEMSA billionaires scandal. But having worked at MEDS, and you say it's the second largest, I believe, after KEMSA in the country, I would want to hear what is it that you will come to do at the ministry that you streamline operations at KEMSA and make it more efficient, more cost effective for the people of Kenya in terms of procurement and delivery of cost-effective drugs to both our public and private hospitals in line with our Kenya Kwanza manifesto. Two, the issue of community health volunteers in the country is an issue that has been debated over the years. I would want to hear your thoughts on what you want to do with community health volunteers that volunteer in our communities. Then eventually, finally, there are about 514 healthcare practitioners. If you may not know, you could or you may not know, I'm sure you've done some research at the ministry, that were interviewed in 2021 and they were given appointment letters by the Public Service Commission in December of 2021. Up to date, the ministry is yet to give them the appointment letters. I have not less than 15 WhatsApp and text messages from young Kenyans who had been given those appointments and now waiting for their letters. Do you imagine if you get approved and you take over the ministry that you will ensure these Kenyans get the appointment letters, or from your initial analysis of ministry, is it that they don't need these young Kenyans working there? Do we have enough healthcare workers and practitioners? Thank you.
One day.
Miss Wafula, in the last term of Parliament, I happen to have interacted closely with the Ministry of Health as chair of the Public Accounts Committee, largely dealing with their audit reports. So I happen to have a rough idea of what goes on in the Ministry of Health. And you'll also recall that the current CS, because they haven't left office yet, the current CS, Mutahi Kagwe, when he came into office, promised to dismantle the cartels at Afia House. As to whether he succeeded in dismantling the cartels, the jury is out there. But coming back to you, even with your impressive technical background, do you think you have the wherewithal, the spine, to deal with these cartels? Because unless these cartels that have held Afia House hostage are dealt with and dismantled completely, we may not achieve much. So just give Kenyans and this committee the assurance that you are equipped, well equipped, to confront this mafia like cartels once and for all. Thank you.
Junet.
Thank you, Chair. Chair, my question to the nominee is, Chair, the functions of health are majorly devolved. They are under the new constitution, and there is a lot going on at the county level in terms of health. But likewise, there have been a lot of problems for the last 10 years since devolution came on health matters at the county level, where whether it is medicines, whether it is staff and medical personnel, there have been serious issues. What are your thoughts on how to deal with the ministry in conjunction with the counties at the county level? What do you think you can do differently that can make things work better this time? Secondly is the NHIF. There is a big problem in NHIF, and people feel that it's not functioning, it's not working properly. What do you think you will do differently that will make NHIF work like any other national insurance scheme, like the way the private ones perform for their clients? And lastly, there was this medical equipment leasing that was started by the last government, and it involved a lot of money, 40 billion, I think, and it was imposed on the counties, and we normally deduct that money here when we are doing the division of revenue at the parliament level, at the source. Even the counties are not given opportunity to pay directly to the national government. Do you think that was a good scheme? Do you think it should be continued, or what do you think? What are your thoughts on that?
You can answer those 4, then we'll take another batch.
Thank you, Chair and members. I will respond to the question in the order in which they came. Honorable Gladys, you sought to find out how I will handle the fragmented type of insurance that we have at the National Hospital Insurance Fund. And as you clearly put it, we have Linda Mama, we have the one for primary and secondary school children, we also have one for civil servants. Chair and members, I'm sure you already know, and if not, that Linda Mama is about 4 billion in a year. The one for AFIA, for the school-going children, is another 4 billion in a year. And the other schemes, but collectively, just if I may use the example of those 2, that means we have a total of 8 billion that has been fragmented. And in that fragmentation, you will note that a mother who is covered under Linda Mama also has a child who is covered under the AFIA one. What that means is that that family has been covered twice in terms of payment. The one for Linda Mama has been paid for, the one for the education has been paid for. So what is supposed to be done is that we are supposed to consolidate. And that would be my suggestion, and it is also in our plan for Kenya Kwanza, that the payments are per household vis-a-vis per persons. Because if you take the total of Linda Mama and AFIA, you put together the 8 billion, it can take care of very many households. And you know, per household in Kenya per year is 6,000 shillings. If you divide that 8 billion, I do not have a calculator with me, but I'm sure it will cover over 1 million households. So I will be suggesting that we move and consolidate these schemes so that then we accrue a lot of benefit from it. And as you may be aware, members, is that insurance works on the premise of the more the better. So I believe with that intervention, we shall be able to streamline. Honorable Kimani, you sought to find out why the chair referred to me as Dr. Susan. As I said in my introduction, that I did a degree in pharmacy from Turkey. But I also said I did not manage to get registered by the Pharmacy and Poisons Board because of the difference in regulations. While I was doing that degree, I was working. I was required by the Pharmacy and Poisons Board and the regulations in this country to do another 1 year round internally, which I was not able to do because at that moment I was still working. I had a life to live. I had beneficiaries that I had to take care of. So I wasn't registered. And because of that registration, I have always not placed my degree document in my folder so that then questions do not arise. You also sought to find out whether I have shares or dividends in Cooperative Bank. I believe, Honorable Kimani, you have better prowess in matters finance. Probably I was referring to dividends, whatever it is, but not shares. But I stand to be corrected, and I think my document shows whatever it is that I have. You also asked, based on my experience, how I plan to streamline KEMSA, the cost of drugs, and the issue of community health volunteers. As I said in my introduction, I interned at KEMSA briefly.
Yes, Kimani.
Sorry to interrupt, but dividends are from Cooperative Bank or a SACCO? Because there's a reason I was asking that, because I see there's somewhere you've put dividends of 1.5 million and dividends of that amount from a bank that is probably paying 10 shillings a share. Would be a very huge investment, and it then would have to reflect in your list of assets. But maybe if it's a SACCO
Thank you, Chair. I have shares and dividends from 2 circles, and that is what makes up the 1.5 million. Back to your question on how I plan to streamline KEMSA. Having interned there, I have a view of what it is that happens at KEMSA as a public institution. And as I said, I also worked at MEDS, which is a faith-based institution. And what then I bring to KEMSA, which I'm sorry to say, but most of the public institution, there's some laxity in terms of operational efficiency. While there, I realized we had a problem with quantifications, how they arrive at what they buy for patients. And at MEDS, quantification was almost accurate to the point. How did we do it? Is that we got to know the needs from the faith-based institutions, faith-based facilities. Early in advance, before we did our tender process, we could find out from the hospitals what their requirements were. Based on that, then we worked on quantification. At KEMSA, they do a push system, where then the stocks are pushed down to the facilities. And the facilities are supposed to be pulling from KEMSA. So the push system then means quantification is done at the top, at KEMSA level. And I'm happy because in Kenya Kwanza we are talking about bottom up. Therefore the facilities will be bringing up their quantities. Based on that, quantification is done. And that is why you hear at KEMSA right now we have expiries, we have obsolete, is because of poor quantification. So we shall start right by supporting KEMSA to ensure that they do proper quantification for products. Regarding cost of drugs, is again because of not quantifying properly, you end up buying wrong quantities at the wrong prices. But more importantly, my suggestion would be like, we do more of local manufacturing. We have molecules that can be manufactured in Kenya. For example, I'm yet to understand why we still import paracetamol. Yet we have companies in Kenya who are manufacturing paracetamol. If we were to buy from these locally manufacturing companies, definitely the cost of paracetamol will be much lower than the imported one. Honorable Kimani, the issue of community health workers in this country is that there are some success stories with community health volunteers. And I'll give an example of Kisumu County. They are moving on very well because they are giving stipends to their community health volunteers. And because this universal health care, they were doing some tests on a number of counties, then we should learn from the success stories like the one for Kisumu, just to find out how has it worked. Then that is what we can move to the rest of the counties within the country, that these community health volunteers then get a stipend, and it can be done on a matching basis, that as much as they are employed by the county governments, then the national government can match that stipend, just to make them do more work. Then you spoke about the 2021 healthcare workers, and members through the chair, as you may know, as much as health was devolved, on Schedule 4 of the Constitution, there's distribution of functions. There's what was left to the national government and what went to the county governments. Recruitment of healthcare workers, most of it is happening at the county government. So then I shall be working with the county governments, and it's supposed to be collaborative. And I am aware there are structures that have been put in place to ensure that the county governments are able to work with the national government. Then is to ensure that these healthcare workers are absorbed in their respective counties. So I may not be able to say that we shall give appointment letters, but once that discussion has happened, and I pray that this committee is able to approve of my nomination, then we should be able to work together to ensure that the workers are absorbed. As we know, most of the facilities in this country are ill-equipped. Even with the healthcare workers, there is a shortage. But also, the executive order, number 1 of 2022, has created a state department of health standards and professional management. So I believe under that state department, then the issues of professional management will be well handled as well in that state department. Thank you. Honorable Wandai, you are concerned about the cartels at Afya House, and I believe I am looking like I'm too weak to handle the cartels. But I would like to assure you that these cartels, having worked in healthcare and supply chain, I believe these are people that I have already worked with. It's just that on a small scale, but now they are on the national scales. And where I have worked previously, Honorable Chair, is that my mantra is P squared, R squared. P squared means process and procedures. R squared is rules and regulations. I am very sure that we will be able to break the cartels, but also be seeking the support of members through bills so that we improve on our procurement regulations and act so that we are able to deal with these cartels, because at the end of the day, if healthcare is working, even the health of those cartels is taken care of. Honorable Junet, you asked about devolved functions in terms of the personnel and staff and how to deal with the MOH and the counties. Honorable Chair, I am aware that we have intergovernmental forums that have been put in place. We have the Specific Health Sector Forum that brings together the CECs in charge of health from the counties. They meet quarterly and they bring their issues from the counties to MOH. And the issues from these CECs of health then escalate to the Council of Governors. And therefore, I want to believe that the issue of healthcare personnel at the county level, then how the MOH will assist them, should be then discussed at this level. But I also want to believe that most of the time issues work when people are involved. And therefore, we shall be involving everyone, each of the health professionals from the counties, in decision making. NHIF, you asked, what is it that I will do differently? Through the chair, Honorable Jeanette, NHIF, as Honorable Gladys had said initially, is a bit fragmented. But the most important thing that I would like to let this committee know, or they may already be aware, that the population, the workforce in this country is about 16 million or 19 million thereabout. Out of this total population, 1 million is in a public sector, 2 million is in private sector. So we have over 11 million people who are in informal sector. And these are the people that we are having a problem with in terms of registration and recruitment into the NHIF. So I will be working together with the county governments to improve enrollment. And through use of the community health volunteers, we should be able then to use them in terms of enrolling these people in informal sector. And you know, the people in informal sector, Honorable Chair and members, is that they rely on a day-to-day in terms of what they earn. Therefore, we have to devise mechanisms to ensure that even from the day-to-day, then we are able to help them to achieve the 6,000 monthly contribution to NHIF. But again, in our Kenya Kwanza plan, we are focusing on promotive, preventive healthcare, and therefore that will ease the burden in terms of healthcare needs. And the study shows that for every 1 shilling that you spend on promotive and preventive healthcare, you save 9 shillings in curative. So as an agent of the government, I'll be ensuring that then we focus more on promotive and preventive healthcare through the NHIF, where they can even have wellness schemes where people go for screening once in a year just to check their health status. Honorable Chair, a question was asked on MES, and you rightfully say that almost 40 billion was put into it, and what are my thoughts? Chair, while I worked at Nairobi Women Hospital, we were able to install 2 CT scans, one 64 slice and the other one 120 slice at 0 cost while I was in procurement. How did we do it? I sourced for the manufacturer of the CT scans. I told them that we have an opportunity, that we have patients but we do not have the money to buy the CT scan. So we agreed on a revenue share agreement that they come and install the CT scans, we provide the patients, and we share the revenue. They take 80%, Nairobi Women takes 20%. And in that, we are able to install a CT scan at Adams and another CT scan at Rongai at zero cost. What am I saying, Chair? That in the world today of management, there's what we call business outsourcing, that you are left to focus on your core mandate. For example, our hospitals, their core mandate is to provide healthcare. And therefore, if we have suppliers, and in this case we do, that supply the MES equipment, it is a good thing. All we need to be asking of ourselves is how was it entered into and how do we improve it? As I sit here today, in my home county of Trans Nzoia, we have a dialysis machine in Trans Nzoia County, which I believe Trans Nzoia County in itself would never have managed to buy that dialysis. So we have gains that have been made. Many counties, many patients have been able to access services that they would never have accessed before. But we have some small issues. For example, I'm told a county that has not installed their equipment because they were not able to get 3-phase power installation. What is that? Honestly, it takes a phone call from the governor to Kenya Power to have 3-phase installation. So why should we keep equipment wrapped in a box waiting for 3-phase installation? So I believe there are a lot of discussions that need to go into that we look at the bigger picture, which is the benefits that have accrued from this equipment. And if there's anything that we can correct, then it is corrected at the review of the contract. Thank you, Chair.
Next batch, Owen Bayer, Honorable Robert Mbui, Mish Mbogo, Daud Posing. We'll take 5. Yes, I have not said I'll follow the line. I may skip and start with Naisula.
Okay, thank you, Speaker and Chair. Wafula, Susan, nice to meet you. I just have 2 questions. One very simple. If you look at Schedule 4, which you referred to, and Item 23, it talks about referral hospitals. That referral hospitals are managed by national government. But the practice in this country has been that referral hospitals, like the Moi, the Kenyatta University, the ones that are built by university are actually managed by university. But we have very controversial issue at Kenyatta University and the referral hospital, where the university has actually been denied a chance to run the hospital and to manage it, and that other board members have been nominated by the minister and put in charge of the university, and they've been told this is a national referral hospital, and therefore even students at KU cannot access that facility. They have to apply like any other, and there has been a lot of controversy about that. As you step in, or if you are confirmed to step into the shoes of CS Health, how are you going to solve the problem at Kenyatta University Teaching and Referral Hospital? Also, a Health Commission has been demanded, the Health Commission has been demanded to bring in all these services together, and we have a Health Commission in this country. It was one of the items on the BBI. And doctors and practitioners in the health sector have demanded that counties should release the function and that we have a Health Commission, just like we have TSC and other commissions to manage medical services in this, or health services in this country. What are your thoughts on this? Do you think that's the way to go, or we allow counties to manage the health sector and also the national government manage another sector? I thank you, Chair.
Thank you, Chair. I would like to say that
Owen, switch off your mic.
This nominee has been very clear in answering questions, and in fact quite impressive. Only that she repeated the P square and R square. I think it's a Kenya Kwanza new slogan. We had that earlier. But Chair, I'm aware that...
Chair, on a point of order. Kenya Kwanza had no such slogan.
Chair, you have to tell the honorable leader of majority to relax. Sometimes you must, you don't take everything too seriously. But anyway,
allowed you to fish far and wide. So
we are in agreement on that, Chair. Chair, thank you. Chair, the Ministry of Health has in the past been a bit apprehensive about the introduction of genetically modified organisms, GMO foods. And until proper research is done so that the health of Kenyans that are, that partake of these foods is assured. In the recent past, and of course we know that the religious organizations have also been against it because of the fact that it's unnatural, because I think there is a belief that food should be provided in a natural manner in which God provided it. Now, in the recent past, I think the cabinet passed that we can introduce GMO foods. Are you comfortable with that position as the nominee for health, considering that there is no research that has cleared this situation? Thank you, Chair.
Yes, Mishi Mbogo, the Honorable.
Yeah, thank you, Honorable Speaker. To the nominee, you sound very conversant on this area of health, but my question will just be not to be compromised, but the many cartels in the MOH, NHIF and other hospitals. That's just a comment on a light note. My question is on mental health. Currently, it seems our government has not taken a lot of care in terms of mental health, and they have not even prioritized it. I'm looking for an example in Mombasa County, where the population is over 1 million people, and we only have a very small center at Port Reitz Hospital for mental health. Recently, we have seen so many incidences occurring from our public sector, be it the military. We have seen some soldiers killing their families, committing suicide. We have seen in our university, in our schools, and yet nothing has been done to ensure that we have access to mental health. This is high time that we need to take adequate steps, and we want to hear from you. What are your plans in terms of mental health? My other issue is on counterfeit drugs. Counterfeit drugs, how are you going to prevent them coming to our country? Thank you.
Thank you. Daud?
Thank you.
Everybody is interested in asking, so I encourage us to have one question each.
Thank you, Chair, Speaker. Congratulations, Dr. Susan, and you've said, you've talked about your degree in pharmacy, and the board has not approved it. Because you're in the department now, I think you should make it easier for everybody else. You will be, hopefully, if we pass you. I'm sponsoring 2 bills in Parliament regarding, one is the cancer bill, and another one is the health amendment bill, where it says, before you take anybody out of the country for medical treatment, you have to go through a panel so that we see if that person can be treated in this country. It would be much easier and cheaper. But if he or she has to go out of the country, then the treatment there should be up to standard. If you are appointed to this ministry, how are you going to tackle what Honorable Owen Bayer has said on transfer of county hospital, the hospitals to the national government, or vice versa, because there is no medicine, there is no personnel. The public health officials are there, but they're not enough, or they're not promoted. So how are you going to handle the public health issue together with the hospitals which do not have medicines, if you will take them over, or what will you do?
The Honorable Posing.
Thank you, Chair. As the Chair said, Ms. Nakhumicha, I'm Honorable Kosing David, MP Poko South. And should you be approved by this committee and the House. There is something which is very serious in this country, particularly health. And if you look at this committee, there are members of parliament here who represent urban centers or urban population. There are also others who represent the rural population like myself. And the question that is bedefiling this country, and particularly at the rural level, is staff at the counties, medical or health staff at the counties. We have really, as a country, politicized the staffing. And up to Mr. Chairman now, locally, is a new word, a version at local level called coast workers. So a governor comes and calls the other staff who have been employed by the former governor, all of them ghost workers. So that the chairman, is easy to just chase them away. And the biggest chunk of that is health workers. So who serves us? Is a Kenyan down there. There's a big, madam, if this house approves you, I will ask that you really travel in our country, go to the rural areas. Those people are suffering, they're not accessing medicine. Why? Because the staff are always in problems or fear. So what will you do, Madam Nakhumicha, should this parliament do something radical? You have the power. Do something that Kenyans will write about you, like the way Michuki came and did some things. You have the power and you have the strength. You are not weak. The laws are not weak. The person can be weak, but the laws are not weak. Come up with something powerful. Finally, also address the issue of drug distribution. Those are two problems that I'm sure it will face you. The excess of drugs at the village in terms of starving. So address the governors, address and don't fear about the devolution. No, think about our Kenyan and your mother and your father at the rural level, and you will really succeed. I will give you power and support as parliament. I thank you.
You can answer to those 5.
Thank you, Chair. Honorable Baya is concerned about the Kenyatta University Teaching and Referral Hospital and the tussle between the university and the Ministry of Health. Honorable Baya, as you may be aware, the matter is before court, and it is yet to be determined. And therefore, where I sit, I may not have a conclusive answer, but mine is just to suggest that there must be collaboration, because the population that the university wants to serve and the population that the Ministry of Health wants to serve is the same. So there must be collaboration and issues discussed, so that then an answer that fits the majority of the population is reached. You had a question on the Health Commission, and that the health workers are have been demanding for this Health Commission, and I believe they are demanding this because of the Teacher Service Commission that seems to be working well in terms of managing the teacher issues. This Health Service Commission, as I had said earlier, in the Executive Order number 1 of 2022, there was the creation of the State Department in charge of standards and professional management. This being a new State Department, and the matters of how we handle the professionals will lie under this department, I will be waiting to see that once this department is formalized, it takes shape, then one of its major would be to get a policy around how then we are able to have this Health Commission, so that it can be in charge of the welfare and human resource matters of the doctors. And I'm happy to say that once we have this, then you will see that there is a harmony. Because at the moment, you realize that there are some counties that have excess resources or personnel, while some counties do not have. I'll give an example of neighboring counties. For example, West Pokot County and Trans Nzoia County are neighbors. If there is an anesthetist, an extra anesthetist at Trans Nzoia County, through this Health Commission, that extra anesthetist should be donated to West Pokot if it does not have. But at the moment, counties are managing on their own, and it becomes very difficult that a theater in West Pokot is not operating, yet a theater in Trans Nzoia County could be having excess personnel. So then this is something that I'll be looking into. Honorable Mbui, you spoke about the GMO foods, and in terms of if they cause my concerns about that. And you said again there are some religious organizations that are saying that these foods are not fit for consumption. Honorable Chair and Honorable Mbui, myself, I'm religious. I'm a practicing Catholic. And the issue around GMO foods, we just had our president lift the ban on GMO. And therefore, there's a lot of conversations that are still going to happen under this GMO. But one of the things that I'll be ensuring it happens, and I'll be seeking the help of the House, is that we are able to move our Pharmacy and Poisons Board from just being a Pharmacy and Poisons Board, but to more in terms of a regulatory, even in terms of food. In the US, you find there's the FDA, Food and Drug Authority. So they are able to look at it wholesomely in terms of medical and foodstuffs. So these GMOs then, if we are able to have our Pharmacy and Poisons Board scale to that height of an FDA, it becomes an authority of food and drug, then they should be looking in this and advising which would be the best way to go. Through the chair, Mheshimiwa Mishi, you requested that I should not be compromised. As I sit here, Mheshimiwa Mishi, I have had over 20 years of experience in procurement. And none of the organizations I have worked for, I have been let go because of procurement. One of my supervisors used to tell me, Susan, procurement is a dirty job, but it got to be done. And therefore, where I sit, I know there are issues in healthcare, the mafias, the cartels and all that, but work got to be done. And I'll be seeking the support of honorable members and members of the House that when we make the radical changes that we need to make to ensure that healthcare in this country is not compromised, then you support me. Mheshimiwa Mishi, you talked about mental health. This is a big concern at the moment. While working for global programs, in one of the programs, we happened to go to the coast to address issues of mental health. And I think it's the country with the largest population of people who are involved in drugs, especially, and therefore leading to stress issues and many mental disorders. So what am I going to do about this? While preparing myself, I got to learn that only 14 out of the 47 counties have facilities that have mental health departments. And therefore, I would be seeking, first of all, is an integration of mental health in primary health care. That the community health workers that was talked about earlier, then when they go to a family in terms of looking at their health, one issue would be screening for mental health. That then we are able to know who are these who have mental health issues. While they screen for them, then they move them through the levels of healthcare, level 1 to level 6 if need be. But most importantly is integration. Because you know, mental health is like almost the basis of everything. Even for one to be socially fit, you have to be mentally fit. For one to engage in economic activities, members, and through the chair, you have to be mentally fit. So I'll be seeking that. But again, of important is that mental health has been neglected. And it's because of the stigma and this discrimination that is around mental health. Actually, in this country, if a patient is referred to Mathare Hospital, you know, many people will be running away from that patient saying, "Huyo ni mwenda wazimu." Yeah, so the first thing that we are going to do is even to rebrand Mathare Hospital, so that then people don't start seeing you as a mwenda wazimu once you are referred to Mathare. Maybe we'll give it a better name. Yeah, so that then that is not there. Honorable Mishi, you are worried about counterfeit drugs. While working at Mission for Essential Drugs, before listing a drug, it had to go under rigorous lab testing. And I believe the laboratory at Mission for Essential Drugs is the biggest in terms of quality control checking on pharmaceuticals. Not even the National Quality Control Laboratory is to that extent. So I am aware that we have institutions in this country that is the NQCL, and through partnerships, public-private partnerships, then some drugs can be checked. Not even some, actually all of them, at the point that they are being enlisted on the Kenya Essential Drug List. They should be checked and determine that the molecule are good enough for human beings. And also the Pharmacy and Poisons Board has to step up in terms of what they do in registration of drugs, the rigorous exercise they undertake, the good manufacturing practices that they check before drugs are allowed to be registered. Thank you. And Honorable Dawood, thank you very much. You said you have brought to the House a cancer bill and a health amendment bill, and your concern was the public health in terms of those two issues. So public health is under the Schedule 4. Of course, in terms of policy, then it remains at the national level. But in terms of implementation, then it is at the county levels. And as I had said earlier, this calls for collaborations. And Chair, in this country, we are not short of regulations, but we are short of implementing the regulations and the good things that have been put in books. So I am seeking that if this committee approves me and eventually I get to be the CS, is that we shall not now spend a lot of time in developing policies and documents, but we look back and now implement that has already been developed. Honorable Kosing, your concern was regarding staff, and you spoke of ghost workers, that the new governments have, the new governors, most of them are regarding the existing professional workers in the hospitals as ghost workers. I do not have a direct answer to that, because when a new administrator arrives, they have their style of doing things. But mine is just to say that everything that is done, it should be within the law, and regulations must be followed. That then they are not just arbitrary, saying people are ghost workers, but instead they are checking whether they are properly recruited and if they merit for their positions. You spoke about traveling.
Chair, I think the nominee, what I was looking at is not for you to administer the governance, is what do at the national level. You need to do something at the national level that will be able to manage even the staff. As you said earlier, in Trans Nzoia, if you have overstaffed or overstaffing Trans Nzoia, that those technical staff can even go and help with Pokot. It's about the same thing, so that those the health workers are not controlled by governors. Because if a new governor comes in, very sure he's going to send the old ones which were employed by the former governor, because they think that they're politicians, right? So they politicize the health sector. I want you to come with a radical knowledge of depoliticizing the health at the county level from the national, so that at least we have these people permanent or so that they can serve the people, not be changed at will of a governor. That's what I meant.
Chair, my question was not answered.
To my understanding, the CS Health has no jurisdiction over employees of the county governments. The only thing that is been debated over and over is whether we have a health workers commission that will then bring on board health workers from both levels of government, the way we have teachers, and then manage it. But that is now within your purview as legislators.
Chair, my question regarding, would you consider as the CS, if you are nominated, taking over some of the level 5 and level 6 hospitals where the
who has given you the authority to ask another question? Yes. If you finished that batch, I want to give another batch. Naisula, Gikaria, Mule, Nyikal, Emase. Everybody will have a chance.
Thank you, Chairman. And to the nominee, Susan, one of the reforms that NHIF Amendment Act of 2002 did was to cure the disparity in terms of NHIF reimbursement. You would find that private hospitals get more than the public hospitals, and also still having in mind that most public hospitals are devolved. But how would you work in collaboration with the counties to see that we improve our public hospitals so that this money, NHIF, will then be paid to our public hospitals so that then Kenyans can affordably access healthcare in the public hospitals instead of just enriching a few people in the private sector? And your thoughts on the split of Ministry of Health into the two departments? What are just your thoughts, and what would you think was the thinking behind it?
Vicaria?
I'm just going to read a question which has just been sent by a colleague from Nakuru. He says, kindly ask her what is her take on the adolescent young people sexual and reproductive health policy, as well as the launched national reproductive health policy that did not go through public participation process. Yet we have so many cases of teenage pregnancy, new HIV and AIDS infection among adolescents, and finally the reproductive health bill in the Senate and your intervention to involve the Kenyan government on the reproductive health bill in East African Legislative Assembly. And secondly, is about these infamous containers. It's about the containers.
If you convey your constituent's question, you forfeit your own.
Okay.
I'll indulge you, but if you convey a question from a person who is not in this room, then you surrender your right to ask your own question so that we can make good progress.
But you've given me...
I've indulged you, yes.
Thank you. And I know that's why my vote went to the right place. To my dear sister, the infamous containers which were brought or bought by the former regime, and they landed at Mombasa at the port. I don't know whether they were taken out to the Naivasha inland place. I don't know what is their case. I've never followed after that. Thank you. Thank you, Chair.
Chair, just
yes,
1 minute.
Yes.
Yeah, I just wanted to correct something because we are unanswered. I said that it was the NHIF Amendment Act of 2002, while I meant to say of 2022. 2022.
Okay. It's corrected.
Thank you very much. Thank you very much, Speaker. Having coming from the health background, I believe that the health sector will be in good hands. That's one of my confess, because of the actual knowledge of this industry. But my concern is very clear, and it runs across board, whereby Honorable Mbui came on board to request on your thoughts regarding GMO. But I want to go to specific. How are you going to integrate National Quality Laboratory, the lab being used by Kenya Medical Laboratory Board, and the Pest Control Board to give a total solution of any product coming into the country for registration and be used for human treatment in this country? And why I'm asking this, and your thought is, we are aware of the tussle between the National Quality Laboratory Board laboratory and the Pharmacy and Poison Board, and if we allow GMO to come on board, I'm very sure you'll find the tussle you are being asked to send those samples to Pest Control Board. It's a highly technical issue which probably, if you don't have an answer, think about it as you get into the ministry, if you are approved, to make sure that we safeguard the life and the safety of 50 million Kenyans going forward as you take up this docket. Thank you very much.
Dr. Nyikal, the friend of the committee, within the confines of your request.
Thank you, Mr. Speaker, for giving me opportunity and also allowing me to attend this vetting. May I take this opportunity to congratulate the nominee and also appreciate the knowledge that she has. Mine is a fundamental issue. All said and done, what has been agreed is that Kenya, like or many other countries, to move to universal health coverage. I know many of us may not even know that the concept actually originated here. That's for another day. And we have agreed that this will be done in the context of universal with the social health insurance as a funding mechanism. So my question is, all this good information you have, what is the roadmap, step by step, that you intend to put in place to get all these together? All these are in bits, but it has to be together for the people to benefit and get health services at a cost they can afford and not paid for at the point of delivery of care, particularly in emergency care. Many people die because when at time of emergency care, people are waiting that they pay. And how are you going to face the challenge? How are you going to address the challenges? Some you have addressed very well, to my mind: the human resource, the procurement, the cost, the component are drugs, the hospitality, the professional costs, and the cost of equipment. How will you put that together, particularly the professional cost, the cost of drugs? And this is in the context of a devolved system where the policy you evolve are national, but you're going to implement them at the county's level, where you will find that sometimes the authority is not there. I noticed that the department has been created of standards, but you also mentioned in the Constitution there is intergovernmental relations structures. So those, to me, that broad issue, if you can get over it, I would be most grateful. And just brief us on it.
Thank you, Mr. Speaker. Mr. Speaker, my concern goes to how the nominee is going to improve service delivery to the level 2, 3, 4 hospitals, especially in rural areas, because majority of us represent constituencies in the rural areas. And my attention is drawn to the issue of conflict of interest that exists between the private practice and public practice by health professionals. Mr. Speaker, you will find that the health professionals have given priority to their private practice vis-a-vis public, to their private practice vis-a-vis public services, despite the fact that they are civil servants. And sadly, you will also find that even the medicines that are procured in this county, in our hospitals, they end up disappearing. And when patients go and they are given prescriptions, again they are directed to pharmacies that belong to some of these very professionals. So I'm wondering, what is the nominee going to do to ensure that you improve on service delivery? And finally, even on the issue of equipments that have been distributed to these hospitals, some of them have not been operationalized because they do not have the right personnel to execute the task. So, Mr. Speaker, we lose so many people. Our mothers go to the nearest health centers. They cannot get the required services. They are referred to the county hospitals. They are referred to the national. They have no money for an ambulance. In the process of trying to solicit funds or seek for support, we are losing an expectant mother. We are losing an innocent child. So, can you tell us what you're going to do to address the challenges that are facing our health sector? Thank you.
You can take on those before we take another batch.
Thank you, Chair. And thank you, Honorable Naisula. And as you rightfully put it, in the act that NHIF is now sending more funds in terms of reimbursement to private hospitals vis-a-vis public hospitals. Mheshimiwa, what we should be asking ourselves is, why are people going to private hospitals? And from my training, we do what is called root cause analysis. That we ask ourselves why, up to the moment that we can no longer ask ourselves why. And from where I sit, the public hospitals are ill-equipped. The public hospitals do not have medicines. The public hospitals, the healthcare workers are not there. Therefore, as a country, then we need more of a paradigm shift in terms of what are we going to ensure, to ensure that our public hospitals are working. If our public hospitals are working, people will go to them, and the reimbursements will not go to private, they'll go to public. But now we are in a catch-22 situation. Should we stop the payments to private? Should we lose life because we've said everyone should go to public? No. So, as if this committee approves of me, then we shall be working together to ensure that our public hospitals are working through proper funding, through ensuring that institutions are working, an institution like KEMSA. If the public hospital is expecting to get drugs from KEMSA, and KEMSA does not have drugs, because they have not paid their manufacturer or their vendor, they have not paid the vendor, and KEMSA says it is because the county has not paid. Therefore, it is a cycle. So we must get to a position where we say enough is enough, and this is where we are going to begin to ensure that public hospitals in Kenya are working. Honorable Naisula, I'll be proud that when I leave, they'll say this is the woman who made public hospitals work. And that is what I intend to do.
Drushia, can I ask her something? What are you going to do about the doctors? Because, you know, most of the doctors, when they go for the further studies, and it's the government which is paying for them. If you go to Kenyatta Hospital...
Kami, you are going to be the next online. Okay.
The reason why the people are not going to the public hospital.
Make your intervention and demand no more after this.
Okay, sure. Congratulations, Susan. My concern is the doctors. What are you going to do about the doctors? Because most of the government doctors, when they go for further studies, they don't go, when they graduate, they don't go back to the hospitals. They start their own clinics. And that's why if you go to Mamarusi, you get to Kenyatta Hospital. If you go to Nyeri Provincial Hospital, there are no doctors. What are you going to do about it?
Continue, Susan.
Thank you. And Mheshimiwa Naisula, I think your other concern is the split of the Ministry of Health to have two departments. And from where I sit, I want to believe that in our Kenya Kwanza plan, we said we shall take services to the people. And therefore, this split is just in ensuring that we meet our promise of taking services closer to the people, and that the lesser a department has in terms of focus, then they are able to do it better. The next question was on reproductive health. Mheshimiwa, I didn't get your name because you're seated behind, neither did I see your plug.
Gikaria. Nakuru Town.
Mheshimiwa Kigaria, National Reproductive Health just like any other health, under Article 43 of the Constitution, every Kenyan has the right to the highest level of health. And reproductive health is one of it. And as you rightfully put it, we have a lot of teenage pregnancies. We have HIV cases. And you're wondering, what is it then that I'll be able to do in terms of involving everyone in managing this menace? So as I said, we, under the Article 43, a right to health. I am aware that there is a national reproductive health policy, a recent one, that I think is 2022 to 2030, that has just been launched, and it provides a framework on how to handle these reproductive health issues. And one of them is the teenage pregnancies. But from where I sit, it will take an approach of whole government, because if you look at these teenage pregnancies, they are occurring to school-going children. And therefore, we must have then reproductive health and sex education in schools, so that then girls are taught how to take care of themselves to avoid these teenage pregnancies. And these teenage pregnancies are occurring because of girls are getting impregnated by adults. So then we should be asking ourselves, who are these adults who are irresponsible and impregnating teenage girls? I once heard on TV someone say that in an area, if a girl teenage is found pregnant, they will be taken to the chief's home to live there. Therefore, it is, for me, I'll be advocating for a whole government approach in ensuring that we have sufficient adequate sex education in both primary and in secondary schools to avoid these teenage pregnancies. And on matters HIV, I am aware that the prevalence level is coming down. The national prevalence level at the moment is at 5%, and therefore we have gained heavily from donor funding. And I'm happy that one of the organizations that I've worked with, global programs, is heavily involved in research of HIV, AIDS. Therefore, I'll just be seeking to build on what has been done so far in terms of managing this. I am also aware that there is a national institution, syndemic, that has been put in place to take care of HIV, malaria, and TB. Mheshimiwa Gikaria, about the infamous containers, I do not have sufficient information to respond to you. But if allowed, once I get into office, I should be able to respond to that. Honorable Mule, thank you very much for noting my, I want to believe, my suitability for this position. And it is, I think the infights between NQCL and the Pharmacy and Poisons Board may not be known outside here, but for those of us who are in the sector, we know about them. And the issue of registration of products. We have put the mandate at Pharmacy and Poisons Board. The testing is elsewhere. So there is a confusion there. And that is why in my earlier response to another question, I said, it is high time then we moved our Pharmacy and Poisons Board to a Food and Drug Regulatory Authority. It will take care of the fighting that is in there. But as people in the sector, that is something that we can discuss further and look at the best way possible. Pest Control Board, I do not have sufficient details on that board.
Point of information, Chair, it's a totally different, it's in agriculture.
I have a very clear mind why I'm asking this. Mr. Speaker, the moment we talk about GMO and we are talking about the safety of the seeds which will come in, and she's talking about Food and Drug Authority, I can assure you we'll have to intermarry those two departments to get the safety of this country. The challenge will be, as there is what is so-called infight on the other end of the NQLC, you still find a challenge with the Pest Control Board, whereby they don't want to be managed from anywhere else apart from the Minister of Agriculture. We are saying this because we interacted with the Pharmacy and Food and Drug Authority bill, which had been drafted by Dr. Bukose in last parliament. And I can assure you, to bring the two ministries together to agree on this, to move on the Food Drug Authority, was next to impossible.
Honorable Mole, if we've been following the developments, the new government, the new administration has brought in place a ministry headed by one of the persons we vetted here, Musalia Mudavadi, who will be coordinating those government agencies. And it will be quite easy to bring together Food and what Farmers and Poisons Board, Pest Control, KFIS, and name it. I mean, that's what his duty will be. And it will be very easy to, a coordinated government will have no problem doing these things. An uncoordinated government will have very difficult ways of getting things done. So let's not live with the history of lack of coordination. We are moving into better coordination. To Dr. Nyikal, and discourage the Honorable Mule from hijacking the floor and engaging in
sideshows. Thank you, Chair. And thank you, Mheshimiwa Dr. Nyikal. I appreciate your wealth of experience in matters health, and I understand where your passion comes from in matters healthcare. And one of the promises that we made, Kenya Kwanza government has made, and it is in our plan, is ensuring that we deliver universal healthcare. You have asked for the roadmap to this, and you are concerned about the out-of-pocket payments by the population, which is very expensive, the cost of professionals, the cost of equipment, and the cost of drugs. Chair and Honorable Nyikal, as we sit here today, you must be very lucky if you are not in a WhatsApp group that is contributing to a medical bill. And therefore, the Kenya Kwanza plan is to ensure that we take care of this. How are we going to do it? Through NHIF. And as I said earlier, that we have a population of close to 11 million Kenyans in the informal sector who are not registered on NHIF. Therefore, my plan, one of it is to start an RRI, Rapid Result Initiative, in terms of ensuring that the people in the informal sector are then registered on NHIF. How are we going to do this? Is through the county governments. I'll just take an example of my county of Trans Nzoia, that we have a population of about 1 million people. 1 million people, and in averagely, if we work with 5 persons per household, that means we have 200,000 households. These 200,000 households is easier, and I'm saying 5 people because I'm taking cautious. I know Western, there are some households with 10 to 20 people, but just for the sake of understanding, 5 persons. It will be 200,000 households. If we put this in at the community level in terms of recruitment, members and through the chair, you are aware that nmucui is working, where matters of security are handled through the nmucui. And therefore, if we collaborate very well with the county governments, we shall also have our own nmucui in terms of the community health group, where such then they'll be following up in terms of recruiting people into the NHIF. And once we have majority, as insurance operates, then we should be able to take care of these people in terms of costs. You've talked of the cost of professionals, which is, I know, regulated by the Medical and Dentist Practitioners Board. However, the cost of drug is not regulated. Chair, while working for Mission of Essential Drugs, I visited India just to check on their manufacturing for pharmaceuticals. And one of the things happening in India is that any drug that is out for consumption, it has something written on it called RRP, Recommended Retail Price. And therefore, you can never pay more than that because it is in public. I know that price regulations in Kenya are not there, but with the support of the House, we should be able to get to a certain level, because these are necessities then where the cost of drugs is regulated. And if we focus more on using locally manufactured drugs for the molecules that can be manufactured locally, I believe we should be able to bring down the cost of drugs, Dr. Nikal. I may not be able to draw for you an exact roadmap in terms of how we are going to achieve UHC, but it's clear on top of my mind that it's going to be progressive. And after some time, we shall have achieved the UHC. And Honorable Emase, you are concerned about service delivery at level 2 and level 3 hospitals and 4. The Kenya Kwanza plan is to focus on primary healthcare, which is promotive, preventive, and rehabilitative. And once we focus on this, I can assure you, Honorable Mercy, that if we take care of the primary health, most people will not end up in hospitals. And even if they did, that we have then empowered the community health volunteers to take record of the health status of their community, then even the referral systems will be working from one referral, from one level to the other in terms of cases that complicate. It is unfortunate that in this age and time, we talk of mothers who are dying on the road while delivering. But I want to believe that once we put in place the NHIF and we have systems that are working bottom up, we should be able to take care of these issues. You've talked of pilferage and of medicines at the local places, and you say most of these are diverted into private practice. Honorable Emase, while working at the Nairobi Women Hospitals, as a member of management, once a month, you are required to be on rotational, where you are in charge of the whole hospital. And it had many outlets. So you could be sent as a member of management to be in charge of the Rongai unit. And you'd be taking care of the hospital from end to end. And one of the things was to know if doctors have clocked in and not. So I want to believe that based on my knowledge from there, this is something that we can scale up. That the doctors are not just paid a salary in public service, but there's an incentive for how many patients they have seen, actual work done. So that you just don't come and drop your jacket and leave. And I want to believe that with the recommendation doctors are bringing of the National Health Commission, we should be able to handle most of the human resource matters around the doctors. The issue of equipment not utilized under the MES due to lack of personnel. One of the terms in the agreement was training of the personnel, and I want to believe that we shall be focusing more on this, that if adequate personnel have not been trained, then what do? We have many people who are graduating from KMTC. So it's just to ensure that these graduates then are properly deployed, and that is in collaboration with the county governments. Honorable Mukami, you talked about doctors when they go for further studies, they don't come back. From my experience, and as I informed members earlier, Chair, while working at Mission for Essential Drugs, I got a loan which I paid for my degree and master's. And one of the conditions from the loan from the Organization for Mission of Essential Drugs is that we were bound for a certain number of years. And I want to believe that works, that once you have sent a doctor, then they are bound for a certain number of years, that then, even when they come back, they are able to work in the public sector. And if not, then they make a refund of the investment that has been put in them, so that then that investment can be transferred to another doctor. Thank you, Chair.
Yes. Clarification, sir.
Pardon?
Just small clarification from her.
Yes, Dr. Nyika.
Thanks a lot. I appreciate the response. You haven't answered the interface between the county and the national government, because you do policies and then they do the implementation, and sometimes that does not run through. For example, when you are talking of quantification on drugs, the quantification should be done at the counties, not at the national government. So when you look at what's happening now, some counties are doing very well, particularly with infrastructure, but others are not. How will the ministry make that, using that interface, if you see how you can maybe think about it?
I'll just
Chair,
take that
Chair,
as a positive
just,
comment. Mary, please.
Clarification on my
Please.
question.
Let me give others as well. Dr. Nyikal, thank you. I take that as a positive comment that the nominee should take into account going forward. Thank you so much. Shuria, Raso, Amisi, Koech, Ferdinand, and George. In that order. Mary, if there is time, I'll give you a minute to clarify what you want. But let others also have a bite.
Thank you.
Asante Chair.
Ameni.
Swali yangu ni moja, lakini naona kuna constituents hapa ametuma swali ama anahitaji usaidizi.
Soma ya constituent, wacha yako.
Asante Chair.
Yes.
Madam Nominee, my constituent here is asking if you're aware that most of the staff at KEMSA were sent home since November last year. And some of them had nothing to do with what was happening because they're working in departments like HR. So he's asking if you're aware of this, if you get the approval of the House, what would you do about KEMSA staff? Thank you.
Excellent discipline.
Thank you, sir. I have to take the instructions of the chair.
Well done. Raso.
Thank you very much, Chair. Susan, congratulations on your nomination. I come from Marsabit. There's something called level 5 and level 6. For those of us who have been marginalized from the beginning, I think even with devolution, we are not yet at level 4. What will be your initiative in terms of actually bringing those hospitals up to the necessary level where the population can get adequate support? When I look at your CV, a very colorful CV, procurement and supply chain manager, I don't want to speak for the appointing authority, but they have in mind healthcare and also how you can make healthcare cheaper and accessible. With this, I want your mind in terms of ICU. How can we make ICU cheaper? Because today, if a Kenyan is admitted in ICU for just 2-3 days, they are likely not to pay less than $1 million shillings or 2. It means majority of people will die when they should actually be accessing the necessary health service because of affordability. Finance Bill 2021. That bill exempted laboratory equipments and certain drugs and reagents on page 34 and 35. Maybe you should be aware of that particular bill. But it has since the VAT has been reversed silently, what would that be in terms of the cost on health? Thank you, Chair.
Missy.
Thank you, Chair. And because you had given Gikari a chance to say something about the nominee earlier, I could also maybe start there that when we worked with the nominee during the politics and she didn't make it through the party denied her ticket, ODM was gracious enough and we seconded her to the Kitale National Polytechnic as a NASA sibling. And Chair, I'm saying this because together with the council that she chaired at the National Polytechnic, we were able to get 100 million for that polytechnic through Magoa. Getting 100 million from Magoa, you know, is not a walk in the park. So I think she's capable of doing miracles. But to my question is, this issue of Cuban doctors, there's a complaint on the local doctors that the Cuban get more remuneration and more perks than the local doctors. Are you going to reconcile, and especially the formation of Health Service Commission? We have Teacher Service Commission that has been able to take care of interests of the teachers, but the doctors have a need a Health Service Commission so that this issue of Cuban doctors on the street striking in this country is not healthy. I remember, Chair, when I went to a hospital and the doctors were on strike, and he asked me whether I'm a politician. I didn't even answer the question because I didn't know how painful that injection will be. You know, the problem is that all the problems of the country, from the doctors to the teachers, are always blamed on the politician until you can fear going to the doctor when they are on strike. So it must be a Health Service Commission in place.
Ms. Nakhumicha, I'm happy to note that Kericho County, my home county, gave you the first breath. Mine will be a question from someone who is watching this interview, and he's talking about the taxation of medical equipment and medical drugs. Actually, it's a proposal that if you are confirmed by this House, that you get into tax framework so that it becomes an intervention, because with those taxes, high taxes, the price of healthcare increases. So what will be your plan as asked by this person watching us? Thank you.
What was the next? Ferdinand, you forgot?
No, I didn't forget. I'm really keen, very keen here. Congratulations once more for the appointment. So I think you're doing well. Now, I want to ask you a question, or rather your comment, on the retention of patients and the bodies. Some hospitals, particularly general hospitals, today, as I'm talking to you, I have a body that's been retained for 6 days in the Eldoret because of non-payment of the hospital bill. What do you want to say about that? And of course, there are also patients who are retained for non-payment of the bills. What are you going to do if you're met a minister for health? Thank you.
Thank you. Thank you, Mr. Chairman. The first question, two of them from my constituents. The first question is from one of the nurses who about a year ago was recruited to go to Britain on expatriate basis.
Yes.
Chair, I wanted to seek your indulgence.
Yes.
That issues that relate to my constituency will be dealt with at the health committee level. We need to deal with the global affairs of health now of the country. But if I bring problems of my constituency, Chair, that there's a nurse that was sacked, what can she do about it? Chair.
Sorry, you've not even listened to the question. It concerns everybody. I'm sorry, this recruitment was for the entire country. by the ministry.
Sorry, I was consulting with the majority leader.
Yes, let me just ask, please. Let me have the leeway. I don't think Junet has any right whatsoever to interject. When you're going to ask about what, I have the right to do so. So please don't. Thank you, Mr. Chairman.
I have the right to raise a point of order, Chair.
Your right to raise a point of order is legitimate. Let him now ask his question.
Let me ask you the question, because the person asking is in the constituency, but is the entire country. Through the Ministry of Labour, a year ago, there was a proposed expatriation of health workers to Britain, UK. That went on, but eventually we are not sure what happened. My question to the nominee is whether, if that chance still exists, she will be able to carry it through, or we do not have enough health workers in the country, as a result of which you're going to absorb everybody who has done health practice and professional. Number two.
Only one.
So, because I have two, absolutely. Number two, very quickly, universal health care. Through the Ministry of Health, in the year 2020, nurses were contracted and they were given contracts for 3 years in the countrywide. Now, these contracts are coming to an end in June 2023. As nominee Minister for Health, would you consider what to do with these contractees, whether it's to absorb them permanently and pensionable, or it's extension of contracts?
Thank you. Your time is up, so compress your answers.
Thank you, sir. Thank you, Chair. Honorable Shure, whether I'm aware that staff at KEMSA were sent home, and therefore what will I do about it? Honorable Chair, I am aware that reforms are ongoing at KEMSA, and as I sit here as a CS nominee, I do not have full details of the nature of the reforms. Therefore, I would request that if this committee approves of my nomination, that once I get into office, then the matter is looked into. Honorable Raso, you spoke about level 5 and level 6, and what do we do to bring up the other hospitals to this level? As I said earlier, the focus of Kenya Kwanza plan is on primary health care, and therefore we shall be looking to equip more the hospitals at the bottom. And once the hospitals are at the bottom are working, there may be very little need to upscale. And if there is need to upscale in terms of then capacity and healthcare workforce, we shall work together with the county governments through the intergovernmental sector, so that then we are able to determine which are the ones to be upscaled. And I want to agree with you that in those areas of Marsabit, Wajir, Garissa, there's a lot of work to be done. You asked about the cost of ICU beds and how do we make it affordable. The simple answer would be through ensuring that NHIF is able to cover for this, and therefore we are going to do the RRI that I talked about in terms of recruiting people to be able to be enrolled into the NHIF, hoping that then it covers all this. About the bill that is there, Mheshimiwa Raso, I do not have full details. I request that you give me time, and if this committee approves of me, then we can have that discussion. Honorable Caleb, thank you very much for sending my name to being appointed as a member of the council to the Kitale National Polytechnic. And you've asked about the Cuban doctors. This Cuban doctors, it was a short-term contract, and it was a bilateral agreement. Therefore, there are benefits that were to accrue to Kenya and benefits that were to accrue to Cuba. And one of the benefits that was to accrue to Kenya is that then we are able to bridge the skill gap that exists. I am aware that the first cohort of doctors that was sent to Cuba, out of the 50, 47 already graduated, and therefore we have 47 family physicians who are going to be absorbed. So in terms of their remunerations, why Cuban doctors are remunerated more than the local doctors, matters remuneration are discussed by the county governments when they employ the doctors. But again, I'm aware that there are collective bargaining agreements that have been signed by unions and the county governments. Therefore, for the national government, is just to ensure that there is collaborations in terms of discussing regarding the remuneration. Honorable Koech, regarding taxation of medical equipment and drugs. I am not a finance expert, and therefore, if this committee approves of me, I'll be working with the CS Treasury to see then on how we work on the tax regimes to ensure that the cost of healthcare then comes down. Mheshimiwa Ferdinand, you have passionately talked about retention of bodies and patients in hospitals due to bill payment. I do not have the magic bullet, but healthcare has to work through NHIF. And therefore, together with the members of this committee and members of the House, whatever it takes to do radical changes to ensure that everyone, and now there's a bill that is mandatory, the listing to NHIF. We have to work together to ensure that that works, so that then the strain on us, the many WhatsApp groups that you are in and I'm in, then we are able to take care of that. Mheshimiwa, the question on expatriation of nurses to the UK and whether that continues or not. This country, training of nurses is being done by very many institutions. I am aware that KMTC only churns out about 3,000 nurses per year. And therefore, I'm not sure that we can absorb them locally, all of them. And if we need to expatriate, I believe we shall be bringing revenue to this country if we expatriate these nurses. So from where I sit, it is something that should continue. So long as we have excess resource, then we should be able to earn revenue from the excess resources. Whether contracts will be renewed or not, every contract must be reviewed on its own merit. If the person has performed well and it merits being renewed, then so be it. If it does not merit, then it will not be renewed. Thank you very much, Chair.
Thank you.
I just want to tell the nominee that she's done extremely well, and that as a Kenyan woman, I'm extremely proud of you.
Thank you very much. Thank you.
Chair,
Yes,
Chair, through you with Chair. That is, I don't know, this is my boss, but that is totally out of order.
She has heard you.
I'm allowed to be out of order.
Dr. Susan, thank you for your appearance and answering questions. The lack of sufficient interventions as you're answering as a story to tell. You will now have 3 minutes to tell this committee your final wishes.
Thank you very much, Chair. I want to thank your leadership and the honorable committee members for the interactive session that we have had. I want to believe that I've been able to demonstrate my suitability, maybe not at 100%, but to a good extent. And therefore, I'll be seeking the indulgence of members that when my issue comes up, that you be my ambassadors in terms of ensuring that then I successfully get to be your CS for health and we move together. But I also want to take this opportunity to thank His Excellency William Samoei Ruto for living up to his promise of bottom-up. As I sit here, the day my name was mentioned, many people were wondering, who is this Nakhumicha? Whether she's so-and-so's girlfriend, whether she's Chepkati's daughter. But I want to believe that I have been able to demonstrate that I merit for this position. And I am looking forward to serve Kenyans in this position. I want to call upon all of you and to pray to Almighty God that we make a difference in the health of this country. Thank you very much, Chair.
You are released to go back to your other duties. As you do so, the Secretariat will check with you on 1 or 2 of your documents. Sergeant, you can show the nominee her way out.
Anatuondoka jukwani Susan Nakhumicha Wafula ambaye amejaribu kutetea ufaafu wake kuhudumu katika Wizara ya Afya. Maswali yamekuwa mengi kwake, kumbuka kwamba ni wizara muhimu zaidi katika serikali. Nakhumicha akisema kwamba ana uzoefu na tajriba ya kutosha, akizingatia kwamba amefanya kazi katika idara hiyo hapo awali, hasa idara masuala ya uagizaji, na ameweza kuweka paruanja masuala kadha wa kadha ambayo ameweza kuulizwa kuhusiana na swala zima la kuwepo kwa tume ya afya ambayo hapo awali ile mchakato wa BBI ulikuwa ukipigia upato. Amesema kwamba atahakikisha kwamba tume hiyo itakuwepo ili kuhakikisha kwamba masuala kuhusiana na afya yanaweza kushughulikiwa na tume hiyo. Ameweza kuulizwa kuhusiana na sakata mbalimbali za ufisadi ambazo zimeweza kuikabili tume hiyo, wizara hiyo hapo awali, hasa ile mamlaka ya kitaifa ya usambazaji vifaa vya matibabu KEMSA, na akaweka paruanja kwamba akichukua hatamu kama waziri basi ataweza kuhakikisha kwamba swala hilo halijitokezi na kwamba fedha za umma zinaenda kwenye miradi mbalimbali. Vile vile ametwikwa jukumu kuzungumzia kuhusiana na swala hili ambalo kidogo lilikuwa limetengwa au halijakuwa likizungumziwa na kuangaziwa zaidi, swala la msongo wa mawazo. Na Nakhumicha amesema kwamba ataweka mikakati kabambe ili kuhakikisha kwamba wizara hiyo inalipa kipaumbele swala hilo, ili kwamba watu wengi wasiweze kufariki kutokana na masuala hayo ya msongo wa mawazo. Bila shaka amekuwa wa 15 kusailiwa na kamati ya uteuzi inayoongozwa na Moses Masika Wetangula ambaye ni spika wa bunge la kitaifa na mwenyekiti, na kwa basi wamesalia watu 7 ambao watakuwa wanasailiwa Ijumaa na Jumamosi. Kesho hakutakuwa na zoezi hili kutokana na sherehe za kitaifa za mashujaa. Kwa hivyo shukrani mtazamaji kwa kuweza kuwa nasi tangia hii leo asubuhi tulipoanza shughuli hii, kwa niaba ya kikosi kizima ambacho kimeweza kufanikisha mahojiano haya na mdahalo huu. Bila shaka waelekezi, wapiga picha na mwenzangu Kamchemenza, tunasema shukrani na kuelekeza moja kwa moja kwenye shirika la utangazaji nchini KBC. Mimi naitwa Timothy Kipnusu.
Kupata skiza tune ya mambo mema, dial *811*815#.
Mambo mema huwaendea watu wanaosubiri, ila mambo mema zaidi huwaendea watu wanaoyatafuta. Kupata mambo mema ni kufanikiwa, na